All right, good morning, everyone, and welcome to FWMD Live. Today, we are discussing Fort Worth's growing influence on healthcare in North Texas and beyond. But before we get to that, let's start with me. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNT HSC School of Medicine. And joining us for our discussion is Dr. Stuart Flynn, the Dean of our School of Medicine, who, in addition to being our founding Dean, is a surgical and molecular pathologist. Welcome, Dean Flynn. How you doing?
Thank you, Prescott. And I want to sincerely thank the mayor for taking time from a very busy day to be with us, and thank our resident in training, Dr. Chaudhry, and medical student, Quinn. So thank you all.
All right. And just like Dean Flynn just said, I want to thank Mayor Mattie Parker for joining us for our discussion today. How are you doing, Mayor Parker?
I'm great, guys. It's good to be with you. Exciting things happening in Fort Worth. I look forward to learning a little bit from this esteemed audience here. Quinn, you included. Don't let these guys run over you, okay?
All right. I want to let everybody watching know that Mayor Parker was elected in June 2021 as the 45th mayor of Fort Worth. She is now leading the fastest growing large city in the nation and has set her focus on key issues that will move Fort Worth forward. And that would include economic development growth, innovative transportation and mobility solutions, quality education opportunities for every student, and building a safer and more prosperous community all across Fort Worth for everyone. Now, I am also happy to have Dr. Adeel Chaudhry with us. How are you doing, Dr. Chaudhry?
Hi, everyone. Happy to be here. Thanks for having me.
All right, we are happy to have you. I want to let everybody know that Dr. Chaudhry is an internal medicine resident at Baylor Scott and White All Saints Medical Center in Fort Worth. He was born in Africa and raised in the Himalayan foothills and also in the Midwest. Now, prior to becoming a physician, Dr. Chaudhry was a teacher with the Fulbright program in Southeast Asia and completed his undergraduate and medical degrees at Indiana University and completed his concurrent Master of Public Health degree in Boston. And last but not least, I am happy to have Quinn Losefsky joining us for our conversation. How you doing, Quinn?
I'm good. Thank you guys so much for having me.
All right. Now, Quinn is a third-year medical student here at the School of Medicine, and she is also a TCU alum. And prior to attending medical school, she interned at Cedars-Sinai Hospital in Los Angeles and helped out with translational stroke research. And she also worked as a scribe at Texas Health Harris Methodist Hospital here in Fort Worth. Now, if you would like to be a part of our conversation, it's really simple. All you need to do is jump into the comments section, leave your question for any of our guests, and I will definitely get you some answers. But before we get to your questions, I'm going to start our conversation with Dean Flynn. So Dean Flynn, can you tell us what opportunities will the medical school bring to this fast growing Fort Worth community?
Well, thank you, Prescott. I love the question. Maybe we'll talk about workforce a little later, so I'll skip past that. I will say, talking to my colleagues in the health district, they're noting that they're recruiting and retaining physicians in a different fashion than in the past, those who want to be a part of this academic environment. We're also, with some of our partners, building a very large clinical trial research consortium. It'll be the largest in the country for enrollment times 10 plus. What that will do is offer more healthcare options in Fort Worth and Tarrant County for our patients. We'll make discoveries here, which will also put our city and our school on the map. And critical, this will be a wonderful attraction for pharma and biotech to consider moving here once they start running trials through us. I should say we work with great partners, many great partners, including UT Arlington. I want to definitely mention them. Elcon, great partner. And then very topical today, and I'm just so happy for Texas A&M's Law School and what's just been announced today. They are a phenomenal partner with us, and we hope to run right alongside of them, doing great things for Fort Worth and for Tarrant County. And then lastly, I would be remiss if I didn't say the school will play a significant role in addressing healthcare disparities in our community, which is obviously a huge deal.
Yeah, and Mayor Parker, I actually want you to jump in. Big news announced in the city today. Can you tell me why the healthcare industry is important for Fort Worth, and how does the city plan to attract more healthcare businesses?
Well, honestly, it's not only a community necessity, but it's the economic driving force behind the Fort Worth economy and continues to grow. I think it's the 5th largest industry sector in the city of Fort Worth right now. There's crazy numbers out there that you can really understand. If you're a data person, understand why do we care about this issue, right? I think that it's around 95% of the 4,000 small businesses in Fort Worth that are really healthcare related. 95% of them are small businesses, which is sort of perfect to mention right now because we're in the middle of Global Entrepreneurship Week. I love the center point that the medical school has created in our community. Obviously, training the next generation of top-notch doctors that we need in North Texas and specifically in Fort Worth, but also this concept around healthcare innovation. You know, the next generation of doctors like Quinn that's on the call today, they're going to drive change just because of the environment we create for them that has to be more entrepreneurial, has to be more innovative. And for Fort Worth and the city specifically, our job really is to roll out the red carpet and cut red tape. To facilitate the next generation of innovation, specifically in healthcare innovation. Because I think you're seeing this happen where you've got physicians that may practice for 10 years and then they create the next best technology. And we want, from a biotech perspective, to continue to be a leader in that space moving forward. So it's a no-brainer for us, Prescott. And then I have to mention also, if you think about what's happened during the pandemic, those of you in the healthcare field knew these issues well. But public health, community health more broadly, as we pivot post-COVID, we have to be better and really do a post-mortem on what went right and what went wrong. And we need expertise like the medical school leading the healthcare industry to help us be better into the future, to not only prevent the aftermath of the pandemic from happening again, but also really work on these health disparity issues that face Fort Worth and Tarrant County specifically.
All right, that's great information, Mayor Parker. I just want to let everybody know, if you're just joining us, this is FWMD Live. Today we have Mayor Mattie Parker, we have Dr. Stuart Flynn, our founding dean of the School of Medicine. We have Dr. Adeel Chaudhry, a physician resident at Baylor Scott & White. And we also have our 3rd-year medical student, Quinn Losefsky, joining us to talk about Fort Worth's growing influence on healthcare in North Texas and beyond. If you have any questions, jump into the comments, leave your question, and I will get you some answers. And so Mayor Parker mentioned those future physicians that we're training. So let's talk to a few of the future physicians that are part of this discussion. So Dr. Chaudhry, what have you learned so far about the needs of the Fort Worth community in healthcare as a physician resident in the GME program with Baylor Scott & White and our School of Medicine?
Thanks for that question, Prescott. I think that this is a very timely discussion to have. Having just moved to Fort Worth and having grown up in small town Indiana, I really appreciate the supportive culture here at Baylor Scott & White, as well as the diversity within the community. As Mayor Parker mentioned, Fort Worth is growing quickly, yet it still maintains that collegial hometown atmosphere, which brings a lot of opportunities. It's a diverse population with a high acuity. With this growth, there's a need for both more primary care and subspecialist access in the area. And one of the goals of our residency program is to help bridge that gap through resources like our resident-run continuity clinic, which helps ensure proactive approaches to health. And when our patients are admitted to the hospital, our resident team will also follow the same patients in the hospital, which helps us build close bonds with a subspecialist consultant. COVID has also really impacted the way patients seek care. We've noticed that many patients are delaying seeking care or waiting longer to go to the hospital. That's influenced how we deliver care. For instance, we're incorporating more televisits into our continuity clinic. Coming from a public health background, I love the collaborative and interdisciplinary culture, not only here at Baylor All Saints, but within our community. On the inpatient side, I've loved working with our social work team to establish care and follow-up for underinsured patients with Baylor Community Clinic, which is here at All Saints, but we also work alongside other health systems in the medical district, such as JPS, which is a county hospital, to inclusively address these needs. This welcoming and collaborative environment, as well as like Mayor Parker's vision, really excites me about future opportunities here after residency.
And Dr. Chaudhry, thank you for sharing that insight. And Quinn, as a medical student, I want you to jump in and give us a little bit of insight as well, because you've been working in hospitals all across the area during your hospital immersions and a longitudinal integrated clerkship. And you also work with physicians at Baylor Scott & White. What have you learned about the Fort Worth community and what we really need in healthcare?
Yeah, I think that's a great question. I think I am in an interesting, unique situation where all of my medical training basically has been during COVID. So it's hard to sort of look back and say, what was it like before? Sort of to Mayor Mattie Parker's point, I think it's important to sort of take this time to learn from all the things that have happened and how this has really highlighted, COVID and the pandemic has really highlighted this healthcare disparity that we see in our community. There's definitely a need for primary care physicians that bridge the gap between specialists and hospital medicine, so that outpatient primary care physicians are always necessary, especially in like a growing community such as Fort Worth. And there's been a really high demand for the subspecialties as well. I think just in general, being in such a bustling community as Fort Worth, it's necessary to have more physicians all across the board. I have really grown to appreciate the role of the primary care physician throughout my longitudinal clerkship, especially within like the underserved population and across the board. Really, everybody needs a primary care doctor. So that has been something that I've seen to be really necessary in our community.
All right, thank you for that insight, Quinn, about working and studying to be a physician in the Fort Worth community here. I want to let everybody know this is FWMD Live. If you're just joining us, we have Mayor Mattie Parker, we have our founding dean, Dr. Stuart Flynn, we have physician resident Adeel Chaudhry with us, and we also have our own medical student, Quinn Losefsky, joining us to talk about Fort Worth's growing influence on healthcare. If you have any questions, just put them in the comment section, and then I will definitely get those questions to our guests. Dean Flynn, I want to switch gears a little bit and talk just a little bit about the physician shortage. So can you tell us about the physician shortage in the US and here in North Texas, and then how these GME programs will help Fort Worth retain those future physicians and then help begin to take that physician shortage down?
Yeah, thanks, Prescott. I want to go off script for a second, just share with everybody what a phenomenal medical student Quinn is. So I just want to give that shout out. She's phenomenal. So I think those of us in healthcare have recognized for some time, not only do we have a physician shortage crisis, but we can see where this is heading, and it's not heading in a good direction. So it's predicted in a decade, we will be 100,000 physicians short in the country, and then Texas proper will be 10,000 short. That is where we will all start to really feel what this shortage is. It's not an issue of us training enough physicians. The issue is residency training slots. You cannot treat patients if you do not do a residency program. And we have well outstripped the graduate medical education slots in the country. And that's why I'm just so proud of our partners and what we're doing in Fort Worth. We've added several hundred new residency slots in Fort Worth, which will definitely attract some of the best in the country to come here and train, including graduates from our school. But we also know that about 75%, and it may be higher in Fort Worth, in the very highly desired places to stay, over 75% stay where they do their residency training. So this will have a huge impact on the North Texas physician shortage. And then part of our job and part of our task is to diversify that workforce, number one, and help bring that workforce and healthcare into rural America. So we have a lot of tasks at hand, but I'm really, really proud of what has happened in Fort Worth in regards to growing graduate medical education slots.
And Dean Flynn, thank you for that information. I want to just insert a question from our audience, and this question is actually for Quinn. So the question is, thank you for your question first. And next, the question is, how important has it been to have residents work with you inside of these area hospitals, Quinn?
I think that's a great question. I really enjoy working with residents. It's nice to kind of bridge the gap between physicians that have been out in practice for 10, 20, 30 years, and they really know their clinical medicine, but they're not used to teaching, versus residents they're still in their teaching phase. They just got out of medical school. They're only one step ahead of where I am, technically. And so it's really nice to have residents around that know exactly what I need to know and kind of are a little bit more in tune with what my level of knowledge is. So it's been really nice to have them around and kind of to to bridge that gap between medical student to attending. And I really enjoy working with them.
And Dean Flynn, we have another question. Thank you for submitting your question. And this one is also about residents, but in your own opinion, Dean Flynn, can you tell us how will having more residents in Fort Worth transform healthcare here?
So first of all, and I had a conversation yesterday, residents are inquisitive, they're smart, they don't know everything, they don't pretend to know everything, and they challenge you on a daily basis with questions of why did you do that? What do you think? How should I go about in my next step with this patient? That's the first thing. It very much challenges practicing physicians. And I cannot speak to the power of that. The other component is, residents are also, it's mandatory that they do inquiry and discovery. And so that's another component that now comes into Fort Worth. Rather than just giving very good healthcare in our community, this now drives the entire process to get better and better. So this is such a huge win. And back to Quinn's point, and we're relatively new with residents in this city, certainly with two of our partners, THR and Baylor. As this grows, this will become a very prominent part of the training, both of our medical students, but also of healthcare students across the realm here.
And since we're having this discussion about the importance of residents helping transform our healthcare here, Dr. Chaudhry, I want to ask you, how has your experience been so far in the GME program working with medical students from the medical school who come in to Baylor Scott and White?
Yeah, so I think it's been great working with the TCU and UNT med students on our inpatient team. Their empathy and the amount of time that they spend with the patients brings a lot of value, not only to the team, but to patient care. And us as residents, we get to further develop our teaching skills and our clinical skills when we work alongside them. I think one of the great things about internal medicine is that we interface with a lot of different specialties. So if a student's interested in PMR or urology, special shout out to my TCU med students. They can still build those core skills on this rotation and interface and collaborate with specialists in those fields. And I think having that continuum of learning here is a really great asset in an academic environment. It really makes us strive together to get better for the community.
All right, and so Mayor Parker, so we're hearing about how residents and medical students can help transform healthcare, but from a city leadership standpoint, how does the mayor help move the needle on these kind of issues in the city?
Well, ironically, I think part of it is what I'm doing today. It's just showing up and listening and learning, and being willing to be a leader that wants to champion the hard work of the next generation of medical leaders in our community. It's not lost on me the power of the medical school to bring talented rock stars like Dr. Chaudhry and Quinn to Fort Worth, to get them convinced this is where they want to live and work and play, maybe raise a family, plant their careers. We didn't have that before, right? We would have lost these amazing intellectuals to other places across the country where they would have planted roots and done the same thing. So our job really is to continue to facilitate partnership, champion the work of the medical school, learn from the physicians that are being trained there and asking the question, okay, on the public health side, a community health side, what do you need in partnership, especially around infrastructure for community health? We know what works. We also know where we have deficits. We understand that Tarrant County continues to have one of the highest maternal and infant mortality rates in the country. That's not okay with me, right? What can we do to really be different? And it's not going to be government coming up with an answer. It's really going to be asking the experts to say, what partnership do you need to facilitate that we have a responsibility as a city and as a county to fund? And then secondarily, it's not lost on me that your students are young people. They could go anywhere in the world, really. And you have to create a city that is innovative and exciting they want to be a part of, because they're not just doctors, right? They're also human beings that want to live in your community. And Fort Worth has got that. We're right at the pinnacle, right? Where you can feel that momentum coming, and people from all walks of life. I mean, think about Dr. Chaudhry's background. Amazing that now you're here in Fort Worth sharing all of that wonderful expertise and background and rich heritage in our community. So as mayor, that's really just simply it. Sometimes shut up, get out of the way, be willing to partner where possible, and help these people feel like Fort Worth is where they want to be long term.
And you know, Mayor Parker, actually, let's keep talking about this because I know maternal care and child care is something that's really big to you personally. So are there some city initiatives you think that can help support those kind of healthcare issues and access?
Absolutely. So it's multifaceted. I'll try to drill it down. For some people that really didn't buy into this, especially with quality childcare specifically, as the issue to pay attention to. Finally, Dallas Federal Reserve, led by Robert Kaplan at the time, our National Reserve banker, going, oh, this actually makes economic sense to really invest in children at a younger age, 0 to 5. But it also aligns perfectly with when you get a child into a quality childcare environment, our primary physicians, our pediatricians, the alignment you can create, especially with a medical school like we have here, to create quality interactions with public health can happen at a much earlier age, especially for families that are living in poverty that don't have access to that same opportunity. So all this is multifaceted and connected. The city of Fort Worth just invested $7 million in ARPA funds to child care infrastructure. We also created this mechanism with Tarrant County Judge Whitley and Mayor Jim Ross to really have a multifaceted approach on the key issues that are facing our community. Things like homelessness, public health, mental health, early child education workforce training, all those things. These are historic dollars coming down from DC. It's our job not to squander it. We want this to make impact for multiple generations. And I know the medical school will be at the table to help us spend those dollars wisely.
All right, that's wonderful information from Mayor Parker. I just want to let everybody know, if you're just joining us, this is FWMD Live, and today we are talking about Fort Worth's growing influence on healthcare in North Texas and beyond. We have Mayor Mattie Parker, we have Dr. Stuart Flynn, our founding dean, we have Dr. Adeel Chaudhry from Baylor Scott White, and we also have our third-year medical student, Quinn Losefsky, with us. If you have any questions, put it in the comments, and I will definitely get them to answer your questions. So, Quinn, I want to bring you back into our conversation again. You are actually getting closer to finishing medical school. You are part of our inaugural class of students, and you'll be graduating in 2023. So what are you looking for in a residency program?
I think that's a great question. It's something that we all have to sort of, wrestle with and ask advice from, attendings, the internet, everything. I think something that I've been looking at, I want to do surgery. And so, especially with surgery, but for really any physician in training, the volume of cases that you get to see, just the sheer number of people you get to learn from patients you get to learn from, and then the diversity of patients that you get to see as well to diversify your toolbox per se when you're an attending is really important. So looking at residencies that see very diverse populations that have large patient volumes, as well as a good culture, like Dr. Chaudhry said, collegial, interactive, not cutthroat, just more working together like a team, as is better for the medical community in general. Something else that is very important is where you're living. Kind of bringing it all back to Fort Worth being a growing city. Living in a city in a location that you enjoy is very important. So I think being able to find a city and a location that you like is also kind of one of the big pillars of finding a good residency fit for you.
Nice. So see, Mayor Parker, you were right on the money. Where you live and it being innovative is important. And we're hearing it from a future medical student that will one day be a future physician. So that's just some good insight from you as well, Quinn. Dean Flynn, I want to talk to you about your Future Accelerators of Medicine and Beyond course at the medical school. Now, you have brought in some of the best scientific, medical and business minds in healthcare in North Texas. And I've sat in these courses with Quinn and her classmates. They've learned with IBM Watson. They've learned about data and analytics. They've learned about robotics. How do you see these kind of courses benefiting medical students and then the community at large when they take what they've learned into these hospitals during their residencies?
Well, you almost answered my question for me. If you'd just gone a little longer, Prescott, we would have been all set. Just succinctly, as many of you know, healthcare is changing about as fast as you can breathe. And so it's no longer good enough to train physicians back in 2000, 2010, and quite frankly, 2021. We have to train our graduates for today, but how they're going to practice is going to be very different. So we have a course, as you said, called Future Accelerators of Medicine and Beyond. And we have more things we could expose our students to than we have time to do. But the content, they spend an entire week immersed in artificial intelligence and machine learning. And IBM has been just a phenomenal partner with this. They've adopted our medical school as their medical school. I can't thank them enough for that. Another is genomic sequencing, and it's already proved power, and it's just going to expand tremendously. It's the impact of our genes on how we metabolize very commonly prescribed drugs, huge. So Illumina, the national international platform for this, has also adopted our school. So they come in and they help train in that environment. We did take a sidebar the last 2 years around COVID. We thought if we're living through a pandemic, we owed it to our students to dedicate some serious time to understanding what was happening with COVID. This year, we folded it back into the main curriculum. And with TCU's tremendous innovation and help, we spent time with our students teaching them about design thinking, how to ask questions, how to answer questions. We will build out, and as you've said, in the world of robotics, kind of wearables, devices that monitor us. These are all things that are going to be mainstream. They're not going to be exotic. And the young people we're training are going to be asked to be facile with this. So the purpose of this isn't to make them experts in any of these. It's to make them not be intimidated when they start to get exposed in the real world. And they'll be ahead of the curve in this regard because they will have already done some pretty cool stuff.
All right, that's wonderful information. And on that note, we will end with Dean Flynn. That will do it for today's live chat. I want to thank everyone on Facebook for being a part of today's live chat, and also a very special thanks to our guests, Dean Flynn, Mayor Parker, Dr. Chaudhry, and Quinn. I want to thank you all for being our guests. We appreciate it so much.
Thanks, everybody.
Thank you.
Thank you.
Once again, I want to thank everyone for watching, and we will see you soon.